I think it shows up every day, every minute of your life, except you don't realize it. Some of us are in denial. They're like, I'm okay, right? So when I did the sky breathing, I just walked in because I like yoga and stuff like that. They said this is good for stress relief. I said, I don't have any stress. I'm a full-time mom, full-time employee, two little kids and whatever I was doing. But he said, just do it for every day for 40 days. I said, fine. When I did that, after 40 days, I realized, oh my God, this is normal. What I was not normal. I thought it was, so if that's all you had, that's what you think is normal. And it used to be called a happiness program. And I know why, because you feel happy 24/7, that peace of mind, calmness of mind. When I'm going to the program or I'm doing the breathing, I feel so many thoughts, right? And it's funny, somebody said, Neelima, when I do meditation, when I do breathing, I get so many thoughts, and that's why I stop. I can't do this. I said, you're not getting the thoughts. The thoughts are getting out of your head. That's what happens when you're doing the breathing. I get all these thoughts. I almost like want to write down with a pen and paper. Sometimes I do that because everything comes to you, but it's all coming out so your mind is clear. So when I'm done with it, there's not a thought to think of. I just can't think of anything. That's how clean your brain becomes. And it's a scientific thing. Breath and emotion are connected. There's a book by James Nestor called Breath. And Sky Breathing Art of Living is evidence-based, and it's CME approved. So you can use your CME money. Our hospital, actually, it's a Catholic hospital. But when we explained to them about the concept and everything, they paid for the doctors to do it during COVID. I've done it on and off, but in the last 5 years, since November 2021, I have not missed a single day because I know what it feels like when I do it. And it's not, you see, you can't change the world. You can change yourself and your response to what happens outside of you. And that's the beauty of it. So whatever is happening outside, I am the same. My nurses almost joke with me like, hey, you seem irritated today, Dr. Reddy. Have you not done your breathing? So I'm kind of notorious for that because I tell the nurses, I tell the patients, my nurse is like, no, my stress, no, nothing a glass of scotch can't fix. So that's their view of doing it. But what I'm saying is the physicians, we have to deal with everything from in the morning you wake up, you have to get there on time, make sure the patient's on time. The nurses are there, patient have taken the prep, there's something broke down, somebody didn't show up, the insurance didn't go through, patient's upset. You are responsible. You are the face of everything that happens wrong, at least. So how do you accept, how do you take it? And it's the people that care, the doctors that care, that get burnt out. If you don't care, and there's some of us, like they just go around and do what they want and they don't get burnt out, I feel. So, or they're just putting up a front of not caring because there's nothing they can do. There's so many issues, reimbursement included, and the what the IT people make us do, right? All of those things. But if you are stable, you're able to deal with these so calmly and efficiently. I finish my notes on time with the patient in the room. I'm happy talking to them, connecting with them. And I usually create these workflows or pathways or algorithms, Google Docs. I share with other people at work. I do a little training on my EMR that I've learned because that makes a whole lot of difference. When I show it to people, they're like, oh my God, this changed my life with GMed. And those are the things that I think when your brain is clear, you come up with those kind of things. And that's why I feel like every single person, if they could do this, it takes 20, 25 minutes every day, 1 weekend to learn it. And it's a life skill, coping skill, however you call it. And I wish everyone would do that for their own sake. And then they can be a better at their job and as a family and everything too.